You are watching The New Normal here on News 12, and let's welcome back right now Dr. Valerie Brutus at Hartford HealthCare, St. Vincent's Medical Center over in Connecticut. Thank you so much for joining us again, Dr. Brutus. I do want to get back to this topic of the pandemic of the unvaccinated. Do you think that the more people hear about the vast majority of cases of severe illness, hospitalizations at this point of people who are unvaccinated, the more that they hear that day in and day out, that will convince them perhaps to get off the fence and maybe get the vaccine?
Absolutely, I think so. I think, if people understand, because a lot of vaccine hesitancy comes from the fear of side effects, especially the fear of severe side effects. I think the more people hear how many people are vaccinated and how rare the side effects are, that would encourage them to get vaccinated.
You know, something that we have been hearing quite a bit from people who have been on the fence or perhaps say that they just don't ever want to get vaccinated against COVID is that they don't want to do it, or they don't even want to consider it, at least, until they get full FDA approval for the vaccines instead of just the emergency use authorization. Just curious to know, just in your day-to-day, is that something that you've been hearing?
That's something I've been hearing. I have some patients that I deal with that also don't want to be vaccinated. Some people are completely against vaccines. Some people are afraid. They want to have the full FDA approval. And I try my best to educate them, to tell them the vaccines are safe. If we think about, more than 400 million Americans have been received at least a dose, 150 million Americans has been fully vaccinated. I feel like these numbers just show us that the vaccines are effective. And also, if we look at the numbers of people getting vaccinated, and the rate of death and hospitalizations are down, that proof is that the vaccine works. So I really hope when people hear that encourage them to get vaccinated. The vaccines are safe.
And how is it that you would sway people, though, when trying to get them to actually go and get that vaccine after waiting for so long? How do you sway people to finally say, you know what, the science, I might not necessarily agree that with the science that's gone into this. And believe me, we've seen so many social media posts from people who still, after all of this, doubt the science. So how do you win them over?
I think I always try to do a brief history of vaccine. This is not the first vaccine that we have developed. Vaccines have been working. Also, the technology, especially behind the Pfizer and the Moderna vaccine, this is not something that's new. This is something that's been studied for a very long time. The application came to term recently, with the COVID, but this is not something that came out of the blue. It's something that we studied for a long time. The J&J vaccine as well have used old vaccine technology. So I tell people, this is not something that's new. This is something that's been studied for many, many years. If we look at the history of infectious disease, most of them were able to control was with the help of vaccine. So I do think, this disease, the best way to protect ourselves and to try to get back to sort of a normal life is to get vaccinated.
And very quickly, let's bring it back to these cases of myocarditis and pericarditis. What is it that you're telling patients, parents to look out for?
Symptoms which are chest pain, difficulty breathing, or having palpitation. So I tell patients to be mindful of the symptoms. If they notice any of them, to call their provider or go to an emergency room. I reassure them to say that 80%, first of all, these cases are very rare. Of course, there are more cases that are being investigated, by the CDC, but so far we only have, a very low number of cases. And I think the most reassuring thing is that more than 80% of these cases were able to be discharged to their home with absolutely no symptoms. Mm-hmm. Some of them, are still being in the hospital, but so far this is very promising to say that the side effects is something that the majority of people would recover with no side effects or residual side effects.
All right, Dr. Valerie Brutus from Hartford HealthCare and St. Vincent's Medical Center in Connecticut. Thank you so much for joining us. Thanks for your time, Doc.
Thank you for having me.